Hello everyone, welcome back. I am Dr. Alexandra, and if you are new to my channel, welcome. So today's video, we're going to be talking about something I think is really important. I think it's kind of the key to getting a good hormonal treatment, a good hormonal evaluation, and that's this concept of marrying labs and symptoms. I honestly think that this is missed a lot, and like I said, it is one of the most important factors because when it comes down to it, we don't always treat every single thing that pops up as being not optimal, right? And it's funny that you're going to hear me say this because I talk about optimizing your hormones on my channel, which I'm a really big fan of. But I'm a fan of optimizing hormones if we have symptoms that warrant that decision. And so I think this really is about why it's important to see somebody who really treats this all the time, why it's important to see somebody who knows what the optimal values are, but also is able to discern maybe which hormone is affected. And so, yeah, without further ado, we're gonna jump right in. But before we do that, if you are liking the videos that we put out on our channel and you're enjoying our content, if you could just go hit that subscribe button and hit the like button and drop us a comment, that would be awesome. Really, our channel is just designed to help women, and we want to get out there to as many people as we possibly can. And hitting the like button is completely free, but it helps us a lot. So if you guys can just go hit that like button for us, that would be amazing. So let's get into our topic today. So what do I mean by marrying labs and symptoms? Basically, right, sometimes in medicine, what I see is patients who wander into my office and they want this list of labs, right? They want to get their hormones evaluated and they want a full thyroid panel. They want estrogen, they want progesterone, they want testosterone, they want fasting insulin, maybe a hemoglobin A1C, whatever that looks like, right? And we go through their case, and some of the labs are not necessarily warranted based on their symptoms. So what do I mean by this? Well, an easy example of this, right, is when women come into my office and they want a full hormonal evaluation run with their own birth control. Well, we know, right, that there are some hormonal changes that happen when you're on birth control, right? We know that testosterone lowers, we know that sex hormone binding globulin raises, so free testosterone lowers, and we know that estrogen and progesterone change because that's kind of the definition of being on birth control. And so we really have to question what's our treatment strategy going to be if we run these labs, right? And do we think that the picture warrants it? The other time when I see this a lot is in thyroid patients. Sometimes there are patients that walk in my office where their symptoms definitely indicate thyroid, right? They're tired, they have cold intolerance, they're having weight gain, maybe they're having a little bit of insomnia because that definitely shows up, or anxiety and depression, which shows up in hyper and hypothyroidism, which we've talked about in previous videos on thyroid. And so it really seems like thyroid is the picture, right? Maybe they're having some constipation and they're having some dry skin and they're having some hair loss. But on the other spectrum, you might have somebody that walks in the office that only has weight gain, right? Their temperature is completely normal, so they're not having any cold or heat intolerance. They're not having any constipation or changes in bowel movements. They're not experiencing that dry skin. They're not experiencing any of the other symptoms. Now, it's not to say, right, if you're having symptoms and everything is quote unquote completely normal, that we shouldn't dive down a little bit deeper, because sometimes people just show up with different symptoms. But we can't be constantly chasing the numbers. I see it a lot where patients sometimes will have labs run and the lab is like a little bit off, right? And I see it specifically with thyroid where it is a little bit off, it's not ideal, but maybe it's not medicatable. Oftentimes we just want to chase that value if we haven't really looked at the overall big picture. And a good example of this is I had a patient in my office the other day who is definitely struggling from some insomnia. And in her case, thyroid plays a huge role in her case, but I honestly believe that a lot of her case is due to perimenopause and changes in perimenopause. And so we're really trying to tease out which hormones are affected and how do we get that balance back, right? And sometimes it's hard because patients want a set answer. They want just like, give me hormones and it'll make me feel better. Which doesn't always work like that, right? And so when we're thinking about running labs, I think the most important thing is that we do a good history, okay? Making sure that labs are actually indicated. This is not a throw spaghetti at the wall and see what sticks, right? And we've all seen medical clinics where there is kind of this gamut of labs being run and we're hoping that something at the end comes out of that. I really do believe that we should be doing some like discerning at the beginning, right? Doing a good intake and making sure that we're running the things that we think are most indicated and taking a step-by-step approach. That's when we really end up being able to get the results, but without over medicating, without jumping too quickly into treatments that maybe are a little bit unnecessary, right? And again, I keep coming back to thyroid because for some reason that seems to be my example today, but sometimes you do see this in thyroid, right? I see it a lot in thyroid patients where their thyroid is subclinical. So what I mean by that is that their TSH is rising. It's not necessarily like that 1 to 1.5 that we'd like it to be, but it's not above 4. So it's not in that hypothyroid range. It's subclinical. And sometimes in those patients, if they are too quickly put on thyroid medication or something like that, thyroid supplement, it really doesn't help them. And oftentimes that's because we have to actually back up, and usually it's a cortisol issue, right? And if we treat cortisol, we treat that HPA excess, the thyroid will actually improve. Basically, the point of this video is if you are like running your own labs, or if you're feeling like you're just getting like a set list of labs run, that could in theory be why results are not happening. Because it really is about creating that full plan. It really is about listening to the symptoms and tying the symptoms to the labs, right? Sometimes things show up on labs, but the symptoms just don't match it. And you know what? Maybe your body's set point is different, right? Like maybe your body's set point for TSH is a little bit different, or testosterone, pardon me, is a huge example of this, right? I always joke with my women that if we ran their testosterone when they were 20, we would have a great baseline for them, but we don't do that, right? We run it usually when things are starting to decline or when things are starting to change. So we don't actually know what their baseline is, right? So we have to kind of take a look and say, hey, does this actually seem like it's low, or does this actually seem like it's contributing to symptoms, or could the symptoms be something else? And oftentimes hormones overlap, right? Like we've talked about in previous videos with testosterone and progesterone. Testosterone is really important for libido, but progesterone, especially like when we have that ovulatory spike, progesterone is a huge contributor to libido around ovulation. So we have to kind of look at the full picture. And I would encourage you, if you've had labs run, to really sit down with somebody who knows hormones, who knows female hormones, who this is their kind of specialty, and go over your symptoms, go over all of the systems and how they interact, because realistically our hormones aren't all in a little tiny box, right? And so how do they interact to create your big picture? That's how you're going to get the best results. So I hope that video was helpful. I know sometimes it can seem like a really good idea when you're feeling bad to just kind of run things. And yes, if we really don't know what's going on and we need answers, then sometimes we might add a few things because they could be what's going on, right? But really, we want to take a more systematic and a little bit more discerning approach, and that's really how you're going to get the best results. So tell me in the comments below if you guys have ever kind of experienced this, where this like throw spaghetti at a wall and see what sticks, or maybe that's where you are in your healthcare journey. And then we'll see you next week for next week's video.